So we'll get all your details done and we will get you your vaccine all ready. Okay.
Carol is about to have vaccine number 3. She's signed up for a new trial looking at the role of booster jabs. That's likely to be key to managing COVID in the long term. The research team want to recruit more over 70s for the trial, as they're most vulnerable to getting seriously ill with COVID.
I think we are stuck with this virus, at least in the medium term. Most of us think that we're going to be stuck with it possibly for years to come. The key thing that we need to do is to get ahead of it. And if we can get ahead of it with booster vaccines or with adapted vaccines, then it becomes for us to worry about as health professionals, and then it becomes less of a major strain on the country.
For now, COVID is something that affects us all, and it's for politicians to decide what levels of restrictions we live with. Most of the country remains in level 2, with cases of the new Delta variant rising sharply.
It is unlikely that any part of the country will move down a level from the 28th of June. Instead, it is more likely that we will opt to maintain restrictions for a further 3 weeks from the 28th of June and use that time to vaccinate with both doses as many more people as possible.
There is evidence the vaccine is helping reduce hospital admissions, but it's early days.
What's increasingly clear about the Delta variant is that it needs 2 doses to give good protection. So far in Scotland, more than 55% of the adult population have had 2 jabs. Around 80% have had at least 1, giving them some protection. But that still means about 900,000 adults are unvaccinated, meaning that they can spread the disease or potentially fall ill.
So you tend to see a
Scientists have warned that moving too fast led to earlier infection spikes. They say it's important to learn lessons from past mistakes.
The virus has been very unpredictable. What happened at the end of last year with the variants of concern was really that was the virus more aggressively adapting to the human population. And what is predictable is the virus will continue to change and continue to evolve. And it seems then wise to proceed with the assumption that worse mutations will evolve sooner than later.
The hope is that this is still a one-way road back to normality, but we may have to stand still for just a little bit longer. Lisa Summers reporting Scotland.